Secretary Duque will now give his statement.
Okay, thank you very much, Dr. Meng. Good afternoon, everyone. Muli, magandang hapon sa ngalan ng Department of Health at lalong-lalo na ang Interagency Task Force on Emerging Infectious Disease and in particular COVID-19. And we are indeed blessed to be joined in by none other than our very own Cabinet Secretary, Secretary Carlo Nograles, who also chairs the Cabinet Assistance System. And the good secretary has been unanimously chosen to join as ex officio member of the Interagency Task Force on EID. So welcome, Secretary Carlo, to our press con. And also with us, of course, is ASEC Rosette Bergeri, who will answer your more detailed questions with regard to updates on the repatriates, the second cohort o yung pangalawang grupo ng ating mga repatriated compatriots. So today, the DOH and the Department of Foreign Affairs repatriated 445 Filipinos from the MV Diamond Princess cruise ship late night of February 25. Returning overseas Filipinos were transported in two batches of 306 and 136 respectively. Among the 445 repatriated OFs are 440 crew members and 5 tourists. They are currently quarantined in New Clark City or NCC, Capas Tarlac, together with the 13 repatriation team members from the DOH, 9 of them, DFA 4 of them, bringing the total of persons under quarantine to 458. Our President Rodrigo Roa Duterte, has directed the Interagency Task Force on Emerging Infectious Diseases to take all the necessary measures to ensure the health and safe return of our kababayans aboard the cruise ship. The well-being of our fellow Filipinos, no matter where they are, is of utmost importance. DOH only allowed the repatriation of Filipinos who tested negative for the COVID-19 in Japan. The repatriates underwent 5 levels of screening for fever and respiratory signs and symptoms. First, prior to disembarking from the cruise ship. Second level, before boarding the bus to Haneda Airport. Third, during the flight. Fourth, upon landing at the Clark Air Base. And fifth, upon arrival at the quarantine facility. All of the OFs, or the overseas Filipinos, were asymptomatic throughout the flight and were transferred directly to the quarantine facility in the NCC. All quarantined individuals will be assessed twice daily, once via telemedicine and another assessment through actual physical examination. They will be provided with food, hygiene kits, and appropriate health services. An ambulance team is also on standby 24/7 to conduct hospital referrals if needed. DOH hospitals in Central Luzon are prepared to cater to those who may manifest respiratory symptoms or fever. As observed in other countries, there is still a possibility that our nationals may eventually test positive upon their return. And we have prepared and equipped our hospitals and laboratory facilities and allocated all necessary resources and PPEs should this happen. So we are ready in case, just in case that eventuality does happen. The department is continuously monitoring the situation and will update its 14-day prescribed quarantine procedure based on evidence and new developments. We have placed measures for the appropriate isolation and management of individuals who may eventually test positive for COVID-19 to contain transmission. We are ready to address any possible scenario. Our priority is always the welfare of our kababayans. Now, on the IATF agreement on South Korea travel restriction, this agreement was arrived at during our 8th IATF on EID just this morning, lasting till early this afternoon. And the task force has resolved to impose travel restrictions for passengers from North Gyeongsang Province, South Korea, including, of course, Daegu City and Cheongdo County, effective immediately. Filipinos and their foreign spouses or children and holders of permanent resident and diplomatic visas will be allowed entry subject to existing screening and quarantine protocols. The travel restriction will be reviewed and re-evaluated within the next 48 hours based on new developments. On the other hand, any travel to South Korea will be temporarily suspended. Only permanent residents of South Korea, Filipinos living for study, and OFWs returning for work will be allowed, provided that they sign a written declaration acknowledging the risks involved, which will be complemented with a health advisory pamphlets. So this ends my statement, and certainly we are open to questions from our media partners and representatives.
Okay, Ma'am Tin and then Sir JC.
Good afternoon, sirs and ma'am. Just to clarify, you said, sir, that any travel to South Korea will be temporarily suspended. So this covers Filipinos who may want to travel to any part of South Korea, like Seoul, for kahit travel purposes, hindi na po pwedeng pumunta.
Consistent yung ating policy with regard to China, Hong Kong, and Macau. So we are uniformly applying the same policy.
Meron po ba tayo, sir, any specific time until when this travel ban will be implemented? Or like with China, still under assessment po?
Everything is always under assessment. There will be a risk assessment and there will be other impact assessments that will be done for the next 48 hours. In fact, we will have to see what the results of the risk assessments will be that will guide the IATF in either expanding the travel ban or keeping the status quo. So depending on what the developments are in South Korea, but suffice it to say that right now there are about 1,170 plus COVID-19 positive cases in South Korea, with 11 deaths, as a matter of fact.
Sec, more on the details lang dun sa mga repatriates natin sa New Clark City. Earlier mentioned by Asek Vergere yung 19,000 kits natin to test them. Dumating na po ba and saang bansa natin to pinurchase?
May I request Asek Rosette to respond to the query?
Yes, ma'am. Katulad po nung sabi natin, the RITM has already started purchasing. RITM has already started purchasing 19,000 kits in preparation for this eventuality. This 19,000 kits already is in the procurement stage with RITM. So we are still awaiting to finish the process so that it can be delivered. Also, coming from an imported source, ito pong kits na kukunin natin.
Wala pa ma'am yung info on the country.
Wala kaming information ngayon dun kung saan country natin to bibilin.
Some of the health workers will obviously be face-to-face with the patients under monitoring sa New Clark City. How can we ensure na hindi sila magiging carrier ng infection? Kasi I'm guessing they'll be coming home to their families as well. So the health workers will just be there. Hindi sila aalis for 14 days as well.
Yes, ma'am. The health workers are there. They are going to stay with the patients and They are going to stay with the patients throughout the 14-day quarantine period. So minimal exposure, that is our objective. So this kind of situation that you're saying would be prevented.
Last.
Actually, even before the WHO's anticipation of a pandemic. Pandemic means a wide geographic area where the spread of the COVID-19 is happening. Okay? We have been preparing long before this anticipation manifested by the WHO of a possible pandemic. And we're doing this at the different levels. At the level of incident planning and management, in case there will be local transmission, we know what to do, just like what happened in the SARS-CoV in Alcala, Pangasinan, where the whole place was quarantined to ensure that the virus is contained, limited to just that family within a barangay. Number two is at the level of surveillance and risk assessment. Okay. Number three would be laboratory capacity building, and this is the reason why we've been increasing the number of our capability for surge capacity in case maraming taong magkaroon ng COVID-2019. Handa ang ating pagsusuri ng RITM. And then we have clinical management and hospital care, as what you have correctly pointed out. We are also leveling up capacities of our levels 2 and 3 hospitals jointly between the LGU and the national government retained DOH hospital. So we've actually given out the guidelines that will clearly show the steps that will level up all the measures, including infection control and prevention. Okay? And then let me just finish the different levels where we have leveled up. Okay? So the, of course, the non-pharmaceutical public health measures such as the the promotion of cough etiquette, of frequent hand washing for 20 seconds, the social distancing where possible, and the measures to strengthen the individual's resistance, not just against COVID-19 but all other microbes. And then we have risk communication and community engagement, which is a very, very important component should we operate under a code red alert level. Code red is the highest. This is the door 4, part of the door 4 response. And of course, we have, so I've said risk communication, the infection control and prevention, the points of entries, identification, saan ba pwedeng makapasok yan. So babantayan na natin yan, part of our surveillance. And then, of course, there's one more I'm trying to recall is operational logistics is are very important consideration in the different levels of interventions against COVID-19.
Sir JC, then Ma'am Aiko, then.
In the event po na magkaroon ng positive or may mag-manifest po ng symptoms during the quarantine, ano po again yung kahandaan natin? Ano po yung protocol na gagawin sa kanila?
Nakahanda na po tayo, sir. We've mobilized about 21 hospitals within Region 3 para tulungan tayo kung dumating yung panahon, kung sakasakali na magkaroon ng tao o yung repatriate natin na magkakasimptoma, sila ay immediately nadadalhin doon sa mga ospital natin. Ang ating mga ospital ay capable na mag-manage nitong patients under investigation natin, nabigyan sila ng orientation, and they are very much capable of managing this case.
At saka po, Sec, add ko lang po, there have been reports na sinasabi yung asymptomatic transmission and asymptomatic din pero positive sa virus. Thoughts on that, sir?
There has been reports for about these asymptomatic individuals who has turned positive. And ito po ay masusing pinag-aaralan ngayon. Marami na po naging eksperyensya ang bawat bansa ukol dito sa mga asymptomatic individuals na to. Even here in the MV Diamond Princess, nakikita at lumabas din sa isang artikulo na marami sa kanila ang nagpositibo kahit wala silang simptomas. So pinag-aaralan po lahat yan sa ngayon kung ano po ang mga naging kadahilanan kung bakit wala namang simptomas ay nagpositibo. Masasabi ho natin yan maybe in the coming months pagkatapos po natin mabuo lahat ng datos natin.
Paano po yun, ma'am? May mga naka-uwi na po, yung mga nakatapos na ng 14-day quarantine. Given that possibility nga po.
They were tested and shown to be negative. So wala namang problema. Na-test naman sila.
Secretary Asek, just like to ask, paano ang protocol kapag may nakita, yun nga, the eventuality na magkaroon ng positive sa mga naka-quarantine ngayon? Will they be transferred to another quarantine facility since meron ng at least interaction with the number 400 plus inside the NCC? Or papaano po yung magiging measures po ng DOH about it?
No, it's going to be symptoms-based. The protocol there is kung may lagnat, may fever, may coughs, i-isolate ka agad yun. Tandaan niyo, as tagi-isang kwarto itong mga ito. So they will be isolated. Meron na tayong nakaantabay na ambulance that will now bring this symptomatic individual to the hospital and be isolated. Nakahanda na po ang ating mga hospital, nakaantabay po ang kanilang mga iba't ibang isolation rooms.
And yung measure po ng DOH with the event din po na pinag-aaralan pa na kahit na hindi po siya nagpapakita ng sintomas, but there are those who tested positive, especially po itong mga galing sa cruise ship. They were also exposed, especially the crew, during the time na within the days na nagstay po sila sa loob ng barko.
Unang-una, meron tayong 80 na nakilala na naging COVID-19 positive. Hindi po yan sumama. So, wala po tayong problema dahil naiwan po sila and properly being managed by the Japanese hospitals under their Ministry of Health, Welfare, and Labor. So, antayin na lang po natin na sila ay gumaling. Meron na nga iba dyan gumaling na. At of course, unang-una, itong grupo na ito, sumailalim na ito sa 14-day quarantine while on board MV Diamond Princess Cruise. But this is the reason why we're subjecting them to another round of a 14-day quarantine period. So yun.
So travelers from South Korea will still be allowed entry into the Philippines except for the areas that you mentioned po, sir. Tama po ba? Apo. So, sir,
Maybe I can ask Secretary Carlo Nograles to respond to that.
So just to clarify, una inbound from South Korea to the Philippines, yung Daegu City, Cheongdo County, which all belong to North Gyeongsang Province, may travel restrictions na po. Mula sa areas na yan, pag inbound from South Korea, from those areas to the Philippines, wala na. Bawal na po talaga. Other areas in South Korea, pwede silang pumunta dito, granting na meron tayong makukuhang some sort of protocol or some sort of certification that within the last 14 days before they travel to the Philippines, hindi sila bumisita ng North Gyeongsang province, anywhere dun sa North Gyeongsang. So very clear yung sa inbound. Sa outbound po, walang Pilipino ang ta-travel to the entire South Korea. Except kung OFW ka or estudyante kang mag-aaral abroad, no? Or permanent resident ka ng South Korea. So, ganun yung sistema natin.
Sir, pinag-uusapan na rin po ba yung possible repatriation of Filipinos from Macau?
Yes, tomorrow pag-uusapan yan. But we are also aware of the possibility, no, na mula sa Macau, meron po tayong mga kababayan doon na magpapa-repatriate dito sa Pilipinas. So that will be discussed tomorrow.
Sir, we're looking at how many Filipinos from Macau?
Well, according to DFA, anywhere between, kasi initially mga 200 plus yan, tapos lumalaki ng lumalaki. So we really don't know the final number. But it started with 210, but now dumami na yung mga ano. So maybe tomorrow we'll get a clearer assessment of the number ng mga nag-signify na mga kapwa natin mga kababayan na who want to be repatriated to the Philippines. No? I also want to emphasize no, na itong with the South Korea, this travel restrictions sa South Korea, we're closely monitoring it. That's why sabi nga namin, within the next 48 hours, we will be constantly assessing, reassessing the situation as it goes along.
Sek, yung sa South Korea, yung sa Daegu, kaya one of the reasons kung bakit nagkaroon ng spike in the number of cases ay dahil it's attributed dun sa religious gathering. Meron na hubang napag-usapan sa IATF kanina on possibly suspending yung nationwide mall sale na i-host ng Department of Tourism by March 1, given na advice na din naman ng DOH na to avoid crowded places?
Well, we are constantly monitoring the situation. So we cannot give you a definite answer to that question until perhaps a little bit closer to the date, the gathering itself, yung mall-wide sale that is going to happen. But we would like to reiterate the position of the DOH, and that is even when those gatherings are indeed necessary, the word is necessary, the precautionary measures must be in place. An example of which is the disinfection procedures that has to be observed. Yung may alcohol ba dyan, may nag-thermal gun ba dun sa mga pumapasok, kung meron lagnat, diretso na sa infirmary ng mall, dapat handa yung mall. They need to have the capacity to manage accordingly. But of course, let us be very clear, there is no local transmission as of today with regard to COVID-19. So you just have to wait for advisories coming from the DOH, and also depending on what policies the IATF will adopt to address this particular situation as the date nears, as the event nears.
Sir, meron na ba hubang lumabas na protocol para dun sa mga flight crew natin na papasok ng Hong Kong and Macau, given na partial pa lang yung ban on these countries?
This afternoon or early this morning also, when we had our interagency task force meeting, the guidelines for the exemption of pilots and airline crew had been already approved. And with this, the guideline states that there would be criterion on when you are supposed to be quarantined or exempted from this just doing home-based quarantine. So we will be sharing the guidelines with all of you later.
Ano po yung protocols ng supply chain and provisions para po dun sa athletes village? Kung hanggang saan po pumapasok yung delivery trucks and vehicles at saka saan po nanggagaling yung supply chain po?
Sa New Clark City po, ang magpo-provide po ng kanilang pagkain, other logistics like toiletries and the rest, yun pong management po ng MV Diamond Princess. So hanggang gate po yun, nakakapasok naman po kasi nasa kaloob naman po ng mga kwarto at ng building ang ating mga repatriates, no? So naibababa nila ang mga gamit. Pagdating po dun sa loob, meron ho tayong mga nakaatas, no? Or nakatalaga na mga aids natin kung saan sila po ang nagdadala ng mga logistical requirements, pagkain sa bawat kwarto. Sila po ay nakadoon ng complete personal protective equipment kapag ginagawa po nila ito.
Paano po yung mangyayari sa waste disposal natin? Saan po natapon yung basura para po mula sa quarantine area at paano po siya dinidispose?
Meron na pong nakontrata na waste disposal company kung saan ang Region 3 namin ng DOH ang nakatulong dun sa aming sa management ng MV Diamond Princess para makontrata ito. So itong mga waste natin doon are considered hazardous waste, no? So meron nakatalaga na pagtatapunan at kung paano ang proseso, kung paano siya i-dispose.
Ma'am, just to clarify na lang din po, kung yung humahalo po ba yung kanilang water system, yung waste disposal system and sewage system sa karatig lugar, just in case. Opo.
I don't think so because this is a building na separate talaga. Hindi siya ganun kalapit dun sa community.
Good afternoon, AC Nichols from CNN Philippines. I just wanted to ask po if napag-uusapan na sa mga meetings yung possible scenarios of maybe locking down certain areas like what they're here in the Philippines po. Like what they're doing, for example, in Northern Italy. I know wala pa naman pong case of local transmission, but napag-usapan lang po ba? And ano po yung preparation level ng country natin if there will be a need to do that in the future?
Let's not preempt what's going to happen. We don't know. What we can say, there's no local transmission, but we have already adopted a four-door response strategy. So, yung door 4 means there is already an epidemic surge. Nangyayari na yung local transmission. And as I have said earlier and enumerated, 7 or 8 steps to address all of this. But I underscore the importance of the LGU's preparation in this regard. And that is why 2 weeks ago, together with the President, we had met with all the local chief executives, the governors, mayors, municipal city mayors, and had detailed the steps that they need to observe and to carry out should a door 4 event happen. Epidemic surge, local transmission, etc. So it's very clear. So there's going to be the same level of preparations at the national level. There will be a replication of that at the local level, at the smaller scales. Okay? So this has to be very clear. And a major operating unit at the local government unit level is the Barangay Emergency Health Response Teams or systems. So ayan, alam na po nila ang bawat hakbang from contact tracing in the locality, quarantine, case management, of course preceded by surveillance, and then after that you have all the things that I have enumerated, at least 8 interventions. No?
Sorry. Sir, yung 10 na discharge na nag-positive previously na crew, are they still in Japan or are they going back to the Philippines? Baka po may info lang.
Yes, they're still in Japan, but I'm sure the communication lines are open between them and DFA, and we are just awaiting advice from the DFA what has been the latest desire or plans of these 10 who eventually got well.
Sir, 67% pa lang daw nung PUIs yung natitrace. Given yung incubation period, hahanapin pa ba yung iba?
Wala na kasi lampas na yung incubation period natin. So the more important thing is to shift to, of course, our preparedness at the level of the facilities. So the hospital capacity building is ongoing. The isolation rooms are being inventoried, and the preparedness is leveled up. The infection prevention and control measures are also in place. So doon na lang sa gamutan, level ng gamutan. Doon na lang talaga dapat ibuhos ang lahat ng dapat isagawa ng DOH.
So sir, yung from that 3 Chinese na positive, hindi na posible na magkaroon ng kaso galing sa kanila, given nga yung period.
Given the PUIs na ngayon, asa 90 plus na lang, 101 na lang, mukhang there is no indication na of the group or groups that might have been exposed to the 3 Chinese nationals, mukhang walang indication na nagkasakit sila. Kasi kung nagkasakit sila, ay dapat nakita na yan sa mga ospital natin na sila yung tumutugon sa mga bawat PUIs. And kung meron man, nakita na natin sana. Pero konti lang naman, yung mga ibang na contact trace, talagang na pasok bilang mga PUIs. But eventually, a lot of them got negative results and thus discharged.
Sir, may information kayo kung ilan dito yung Filipinos, ilan yung Chinese, and yung mga foreigner, nakaalis na ba ng bansa?
Well, patungkol sa ating PUIs, meron tayong Filipinos 72.5%, followed by Chinese 20%, Americans 3%, and iba puros mga less than 1% na lang.
Mga nakaalis na po yung foreigner.
Malamang, yung iba rito, ang alam natin ay na-discharge na sila, whether nakabalik na sa kanilang mga bansa, yun ang hindi ko masagot sa ngayon.
Sir, yung sa travel ban, can you just give us yung reason bakit magkaiba ng level yung to and yung from Korea? Bakit yung galing Korea ito lang, tapos yung sa effectively parang total, except may mga categories na in-exempt?
There's an assurance from the South Korean government that they'll be able to contain yung problema at isolated. Most of the cases are isolated in these 2 areas, meaning say mostly Daegu City and Cheongdo County, but in-expand na lang natin sa buong province of North Gyeongsang. So kaya nag-spike naman yung numero is because of yung nangyari yung sa isang simbahan. So because highly concentrated doon, then the task force felt that we can impose the temporary travel ban dun muna sa area na yun, subject nga to the 48 hours na masinsinang assessment at reassessment ng gagawin natin. So in the meantime, yun lang muna because may mga assurances naman na binigay ang South Korean government that it is just clustered in that area and they are containing the event or the scare dun lang sa area na yun. So, again, 48 hours nga na assessment at reassessment. Ang gagawin natin, kung makikita natin na medyo kumalat na sa ibang lugar, then that will be another point of consideration ng task force.
Pero sir, bakit yung from the Philippines?
From the Philippines, yung outbound, kasi syempre, yung consistency natin na yung the same way that we treated dun sa China, Macau, and Hong Kong, na yung outbound nga ay pinagbawalan natin if it's for other purposes other than being an OFW or being a student or a permanent resident. So yun yung naging point of decision natin.
Sir, may mga clarification lang. Sir, yung may pinag-uusapan rin po ba repatriation from Korea pabalik sa Pilipinas? And paano po yung mga dumating sa Philippines from Korea before the announcement of the ban? Ano po yung advice natin sa kanila?
Well, the DFA is advising the embassy of Korea about this most recent development, and I'm sure that preparations are being made so that issues of them getting stranded will be resolved. So we have to await advisories coming from the DFA with regard to this. So siguro that's a good question you might want to reserve for DFA to answer.
Sir, we'll be having two last single questions.
Yes, please.
Two last single questions, Boborazo din.
Kay Sec Nagrales po, from Bomboradio po. Napag-usapan na po ba sa meeting yung economic impact nung since yung first na nag-ban po tayo is travel from China and now affected na rin yung travel to South Korea. Nakita naman po natin na yung Chinese and Korean, sila po yung parang top na mga tourists natin. Ano po yung napag-usapan doon ng task force? Kasi may mga reports po na yung Boracay, yung LGU po doon ng Kalibo, very concerned sila when it comes with their tourism po.
Yes, so this is obviously latest development, no? When we did the numbers dun sa maging impact nito sa tourism, it was only based dun sa impact with regard to yung travel restrictions from China. So we will be assessing now and computing anong maging impact nito as far as tourism is concerned, and we'll get back to you on the numbers soon. So if a factor in na namin ito, especially when it comes to tourism, pati yung sa remittances, if a factor in din namin ito, if ever. But as far as remittances is concerned, remember na hindi natin pinagbabawalan yung OFWs natin to go to South Korea. So hopefully it will not affect yung OFW remittances natin, no? Yung ano lang, yung sa tourism lang yung magiging, I think, primary effect nung ban dun sa South Korea. But remember that the ban for inbound is only as regards that one province. So baka hindi rin ganun ka-significant yung magiging effect because right now, no, as of the moment, again, it might be subject to change within 48 hours or so, but kung dun lang sa province yung may ban tayo nung travel coming in or inbound travel, then maybe the impact won't be so substantial.
Last na lang po. How is the government or the interagency task force na pag-usapan po yung dealing with the if ever worst case scenario happen? Kasi sa Hong Kong daw po, because may decline sa stocks sa Asia Pacific, yung permanent residents nila parang makakatanggap ng equivalent ng 64,000 from their fallout po.
Well, siguro if we ever give any assistance, it should be targeted, no? So titingnan natin kung how much of the employment numbers ang maapektuhan natin dito. So kunyari, for example, if ma-affect nga yung tourism industry natin, ano yung magiging fallout nun in terms of employment? So meron tayong several options, no? If member naman sila sa SSS, then we need to talk to SSS about some unemployment assistance na pwede nilang gawin, or through the Department of Labor and Employment, maaring pwede natin tulungan sila sa paghanap ng bagong trabaho or some sort of financial assistance na maaari natin ibigay when it comes to that. But right now, kung for example ang maapektuhan lamang is tourism, we really have to find other means to promote and boost tourism elsewhere. Whether it is from other parts of the globe for international tourism or to boost domestic tourism nga. And this is where the strategy of the DOT comes into play. Na they're trying to boost domestic tourism to compensate whatever foregone revenues we will have dun nga sa losses ng international tourism natin from China and from some parts of South Korea.
Provincial capital sa Cebu, hindi daw po nagsisindi ng aircon. Kasi sa paniwala nila, hindi mabubuhay yung virus sa mainit na kapaligiran. Tama po ba ito? And second, what could we be doing right kaya wala pa ring local transmission hanggang ngayon?
Hindi malinaw sa akin yung bakit ayaw nila mag-aircon dahil paniwala nila ay the virus might be difficult to inactivate if the temperature is low or cold and the humidity is dry. That is possibly the angle by which they've considered not turning on their air conditioning units, but it's not very clear. There's no evidence as of the moment, no science behind it. So it is perhaps speculative to say the least. The WHO has not given any advisory with regard to shutting off the air conditioning system to lessen the chances of the COVID being transmitted and propagated. So that's a bit granular, but we'll ask WHO. And so, yung kanila, I just wanted to add to the statement of Secretary Nograles with regard to the social protection safety nets. No? For the OFWs, the OWA is the social protection agency that ensures that whoever is disadvantaged among the OFWs, the OWA's bounden duty is to provide temporary assistance to tide them over until after they get stabilized and perhaps are able to get new employment elsewhere. Thank you. Well, we're doing hopefully a lot of right things at the different levels because several weeks have passed and the country still hasn't any report of a local transmission. So we've improved our surveillance at the airport. The Bureau of Quarantine has been activated since January 4. Even before we had these 3 imported cases, we already leveled up the surveillance capacities of BOQ. And as a proof of that is the significant increase in the number of thermal scans that we have deployed from 38 to 58. And then, of course, for the Epidemiology Bureau, it has mobilized all of its surveillance officers for contact tracing that it did undertake together with the PNP and the Criminal Investigation and Detection Group, or CIDG. The laboratory capability, before we needed to send our specimens to Australia, Melbourne, for definitive testing. But now we already have the capability to detect and isolate and detect the COVID-19 using the RNA primers that have been donated by the Japanese government at the first instance, and at the second instance, the WHO had complemented this supply of RNA primers, a chemical that is important to detect the presence of COVID-19 in the oropharyngeal and the nasopharyngeal swabs or specimen. And now, as was correctly pointed out, the RITM is aggressively addressing the extraction kits necessary for testing. Meron na po tayong natanggap mula sa WHO, yung pong RNA primers, yung chemicals, yung reagents, kulang na lang po yung mga extraction kits. So ito po ang atin inaantay. So yung hospitals naman natin, yung kanilang infection prevention and control measures are very much in place. All of these are reflected in the set of guidelines that has been issued out to all of the DOH hospitals, the private hospitals, as well as the LGU hospitals. So the prevention measures, the frequent washing of the hands, which is the most important precautionary measure, preventive measure, frequent washing of our hands. Okay? The more, the better. Okay? If none, alcohol will do. And then, of course, the cough etiquette, the social distancing, all of these preventive measures are of extreme import, and the mitigation measures that in case there are COVID-19 cases admitted in the hospitals, that the hospitals will ensure what is known as the clinical best practice management of individual COVID cases. To mitigate, the possibility of patients dying, we'll do our best so that the death rates will not, no deaths will happen, but of course, if and when it happens, hopefully it will be minuscule or really very low ratio.
Thank you, Secretary Duque.
Siguro,
for final...
to add to what Secretary Duque just said, siguro yung i-emphasize ko lang, yung citizens' participation and support. Yung sinasabi nga ni Sec Duque is very important. I think that's why we've been successful so far. Everybody's cooperating. And then, number 2, yung LGU support din. Napaka-importante na nandun yung support ng ating mga LGUs. And then in terms of the national government level, nagtutulungan ng lahat. There's a whole of government approach here. We have the task force is really working on it. May mga technical working groups, pati sa economic side. Lahat yung pinag-uusapan. So well synchronized ang mga moves natin. And of course, the President is really on top of the situation. And we're getting all of the support from the President. So napaka-importante po ang lahat ng yan. And of course, media. We won't be able to do this without the support ng media. And mukhang bumabawas na rin yung mga fake news. So natututo na rin yung mga tao na huwag maniwala sa fake news. And we expect and hope that everybody will continue to cooperate that way and just support the government and then rely on official government data and government informations, mga info drives na ginagawa namin. And salamat na hindi na kinakalat yung mga fake news dahil hindi talaga nakakatulong yan.
Thank you. We would like to thank Secretary Carla Nograles for gracing our press con right now. In behalf of Secretary Duque and ASIC Brigary, we would like to thank our partners. So that concludes our regular press briefing for this day, Wednesday. We'll be updating our major partners on the next schedule. Thank you very much. Magandang hapon po sa lahat.